MoodRhythm is an app to help people with bipolar disorder to learn about their personal rhythms and to stay in balance. Bipolar disorder is a common and lifelong illness that affects men and women equally regardless of their background. It's associated with poor functional and clinical outcomes. One of the most prominent features of bipolar disorder is its rhythmicity. A person's mood can fluctuate from the most intoxicating highs to depressed lows. Life events such as stress can affect a person's social routines and sleep patterns and ultimately lead to the onset of manic or depressed episodes. MoodRhythm helps people with bipolar disorder to live a more naturally rhythmic day, ensuring that they can maintain balanced and healthy lives. It does this by building on and beyond current clinical practice. An elegant smartphone diary provides immediate visual feedback and encourages self-report as patients record their activities as well as their moods and energy levels. Notes can be used to record additional information, such as the amount of medication taken or factors that may affect a patient's routine or mood. In designing MoodRhythm, we have taken into consideration how it will be used not only in a patient's daily life, but over longer periods of time and when a patient is particularly symptomatic. At these times, self-tracking can be difficult to maintain. MoodRhythm uses sensors that are already on smartphones in people's pockets to automatically detect levels of sleep and social interactivity. Our social sensing algorithm gauges the level of social activity in a private and sensitive way, without listening to what a person is saying. Our cutting-edge sleep sensing leverages multiple smartphone sensors to sense how many hours a person has slept and their sleep environment. The MoodRhythm system is built using an open mHealth architecture, which makes it very easy for others to use these technologies in their own health apps. We also consider how MoodRhythm could complement and extend clinicians' existing ways of working. MoodRhythm's web dashboard supports clinical decisions and helps accelerate patients' personal learning. Clinicians can gain a richer picture of a patient's routine and daily sleep and wake environment in order to inform medication decision-making and guide the patient towards personal insights. MoodRhythm helps patients become more aware of their daily patterns and adhere to their therapeutic goals. It does this by 1. Making self-reporting fun and effortless, 2. Creating more reliable clinical information, 3. Creating a rich picture of how and why a patient's mood fluctuates with their routine, and 4. Using smartphone sensors to reduce the need for self-report measures. MoodRhythm supports patients on the go, helping them to track their routine both actively and passively throughout their day and over their lifetime. Use MoodRhythm to stay in balance and learn about your personal rhythms.